Welcome to Mock Interview Pro. If you're gearing up for an interview as a medical coder, you're in the right place. We're here to guide you through some common questions and help you prepare thoroughly. Let's dive right into our first question about teamwork in resolving coding issues. Can you share an experience where you worked with a team to solve a coding problem? Interviewers ask this to see how well you work with others and handle teamwork in challenging situations. Here are a few pointers on how to tackle this question. Pick a clear example from your past experiences. Describe the coding problem and its impact on the team. Explain your role in finding a solution. Emphasize how you collaborated and communicated with your team. Wrap up with the outcome and your takeaways. Let's see how an example answer might sound.
In a previous job, our team faced a significant issue with our medical coding software that led to incorrect billing. I took the lead in organizing a meeting with the coding staff to discuss potential solutions. We brainstormed and implemented a new guideline for verifying codes, which improved our coding accuracy by 30%. This experience taught me the value of teamwork in solving problems.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Medical Coder. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time you had to quickly adapt to changes in coding guidelines or procedures. This question assesses your adaptability and how you handle changes in your work environment. Here are some tips to smoothly answer this question. Identify a specific change you encountered. Describe how you learned the new guidelines. Talk about how you applied these changes to your work. Highlight the positive outcome or improvements from this adaptation. Focus on your personal contributions. Here's an example of how to structure your response.
In my previous role, new coding regulations required me to quickly update my knowledge. I reviewed the updated manuals and attended training sessions, revising my practices accordingly. This approach resulted in a lower error rate in my submissions, underscoring the importance of staying adaptable.
Describe a time when you disagreed with a healthcare provider about coding. How did you handle it? This question explores your conflict resolution skills and how you manage professional disagreements. Consider these points when preparing your answer. Maintain a calm and professional tone. Clearly explain your coding rationale with guidelines. Listen to the provider's perspective to understand their view. Seek a collaborative solution involving a supervisor if needed. Document the discussion and resolution. Let's look at an example of how you might handle such a situation.
Once, a provider wanted to code a procedure as a higher level service than appropriate. I calmly explained the specific coding guidelines supporting my choice. After discussing, we decided to consult our supervisor to ensure both perspectives were considered. This open dialogue helped us reach a mutual understanding.
What steps would you take if you found an error in a code that has already been sent for billing? This situational question gauges your problem-solving skills and attention to detail when resolving errors. Here's how you can effectively outline your approach. Identify what the specific error is. Review the billing details related to the error. Communicate promptly with your supervisor or billing department. Correct the code following guidelines and resubmit if necessary. Document the error and corrective actions. Let's walk through an example answer to this question.
I would first identify the coding error, then review the associated billing details. I'd immediately inform my supervisor to ensure transparency. After correcting the code according to guidelines, I would resubmit it for billing if needed. Finally, I'd document the error and resolution process for future reference.
Imagine you're tasked with coding a complex patient case with incomplete documentation. How would you proceed? This question tests your ability to maintain coding accuracy and thoroughness in challenging situations. Here's how you can navigate this situation. Thoroughly review existing documentation to find any available details. Consult healthcare providers to clarify missing information. Apply coding guidelines to assign the most accurate codes. Document any assumptions you make during the process. Keep a record of queries and responses for future reference. Now, let's see an example response.
I would start by thoroughly reviewing the available documentation to identify missing elements. I'd reach out to the healthcare provider for necessary clarifications before proceeding. Using the coding guidelines, I'd ensure accuracy and document any assumptions I made.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.